Okay. This is we're going to do some information on board training refresher, just so that we have some clarity on some of the things that we are expected to do. And so Randy provided these slides. They're from the American College of Healthcare Executives, but via who, Randy?
One of the attorneys that I've worked with before, collaborated with them to put these slides together for board governance and training. And we did have Allison review those. So.
Yeah, we did. So, okay. First slide.
So we just go ahead and eat.
Here we go. Okay. This slide just says the state and federal law established parameters for nonprofit public boards should be structured and function. So boards are required by the law to have a board that assumes fiduciary responsibility for the well-being of the organization. And state, as it said before, the state and federal law establishes the parameters for how we need to be structured. Governance is unique because the authority is placed in the boards as a collective body, and this authority is exercised through the board formally as it convenes at its meetings every month. So,
hey Dottie, could you guys
ma'am.
put it in the presentation view so it'll show up a little bigger?
Okay. Piper is kindly manning the controls.
Thank you.
Sure. There you go. Okay. So individual board members have duties and responsibilities, but never alone. They have no authority for decision making. So this brings me back to a topic that, I've heard over the past couple months that employees at the hospital have been told that they can't speak to board members, which is absolutely not true. The board members can speak to anybody they want to. The issue is that board members should not be speaking as individuals about board topics. So, that fallacy of that board members can't talk to employees or vice versa has never been true. And I'm sorry that it was misconstrued by anybody. And for the guys that are here, the employees that are here, I need you to pass that along so that they're not confused. So, the whole thing is that individual board members can't act on any board subjects by themselves because it's the board that acts as one. And that's where the confusion always is. So after discussion, debate, and voting, the decisions are adopted by the whole board, whatever it is, whether, we have 7 individuals with 7 personalities and everybody has an opinion. So what the board does is discuss it, talk about it, come to a decision, have a vote, come to a conclusion, and that's what everybody should follow. So there's a lot of confusion around that. Next slide. The strategic board composition is responsible for ensuring the board members are oriented and engaged. And this is the purpose of the training tool that we're talking about, that orientation, and preparing and ensuring it elects board officers. The strategic plan that we know very well, it provides the mission, vision, and values, and oversight of we as the board do oversight of the strategic plan. And then we engage in, ongoing strategic thinking as a partnership with the CEO. Various forms of oversight. The board provides oversight of financial, quality, corporate compliance, and CEO. The board also ensures there's plans in place to manage the risks of the hospital/healthcare system that we oversee. The responsibilities of the board of directors is we hire the CEO, we partner with the CEO to establish performance goals. We periodically evaluate the CEO, which we have to initiate and talk about later. We approve the compensation and the contract of the CEO, which we've done. And we partner with the CEO with day-to-day management aligned with that his management is aligned with board established priorities and policies. The policies we approve the organization's bylaws and then key policies as they come up, whether they need to be reviewed or changed. Okay. The board ensures its meeting and committee structures are effective and the board has a healthy culture, but it also ensures that it understands and engages in good governance practices. The board helps ensure various types of resources, which include reputational resources, community and financial resources. And that's what we do all the time. So the individual duties and roles in a nonprofit organization is legal. We each have legal responsibilities commonly described as duty of care, duty of loyalty, and duty of obedience, which if you look at every board training that was ever done, these three things are in there. And so then these slides go on to explain them. So they can be applied in the court of law by Internal Revenue Service and to determine if an individual board member has acted properly. These three duties apply to all decision-making, every action, and every strategic plan. And board members are responsible, even if they don't attend meetings regularly or participate in discussions. But from a legal standpoint, a board member who does not abide by these duties can be considered negligent and personally liable for actions or inactions. So duty of care is explained as engaging in hospital business. Board members must use good judgment and a level of care that ordinary prudent person would exercise in a similar situation. You're not expected to know everything, and Lord knows, I know I don't. So, but they are asked to consider and rely on the advice of the management of outside advisors, i.e. legal, legally expected to be aware of what's going on and make reasonable inquiry and to act in such a manner that, again, reasonably believe is the best interest of the healthcare system at the board meeting. Duty of care, the board members must use good judgment and a level of care, again, that an ordinary prudent person would exercise in a similar situation. So here's some examples on how you fulfill your duty of care. You attend your board and committee meetings, you are prepared, you read the packets or whatever is given to you prior to the meetings, think independently, get all relevant data and information before making a decision, and then review performance. So if there's anything in particular interest that you should want to talk about or bring up at the next board meeting, you need to let me know or the CEO know that so we can put it on the agenda, because that's who does the agenda. Next is duty of loyalty. And this prohibits board members from using their board positions to benefit themselves, their immediate families, or any of other businesses. So it's putting yourself before, putting the hospital and the board before your own personal needs. So you're free of any conflict of interest and maintaining confidentiality, which is absolutely imperative in the position that we have. Confidentiality is crucial. The duty prohibits board members from using their board positions to benefit themselves, which is just repetitive of what the last slide said. So we have to review conflict of interest policies annually, which we should be doing. I know that we do that when we sign on. We annually review for sitting board members to identify key affiliations, immediate family members, and employees. So if anything comes up where there's a conflict of interest, we just need to identify it, address it. And then that also includes a policy that when a conflict arises, the individual discloses the conflict and then rescues themselves from deliberation as well as voting. And then there should be no personal gain from any board opportunities. And again, they mentioned confidentiality. Duty of obedience, it requires the board members to be faithful to the healthcare system's missions, follow all state, federal, and local laws, and abide by the bylaws when representing the interests of the health center. So this duty is demonstrated when board members protect limited resources to ensure maximum benefits. So that would be, patients' access to care, added service lines, those kinds of things. The board members fulfill this duty by participating in a comprehensive orientation program, which again pertains to the tool that we're talking about. Understand the mission and how it's achieved by the healthcare system. Act in a manner consistent with the healthcare's missions, goals, and objectives, and advance the mission when representing the healthcare system in the community. So we're always a representative, no matter where we are. Okay, governance versus management. This is another important thing that's very hard to understand sometimes, and also very easy to slip over one side or the other. The board governs while the executive director is responsible for overall management and healthcare system. So the board's only employee is our CEO. Everybody else belongs to the CEO, and it's not our responsibility. The CEO is the only employee hired by us, but then we delegate the day-to-day operation responsibility to the CEO. And the staff is managed by the CEO. The board implements priorities and policies. We have shared responsibility. It's to note that there's areas of shared responsibility between the board and the CEO, because we're both participants in the governance process, and we steward the resources, which means that we take care of the resources that we have and then guide the health center and ensure effective functioning. Where we can get into trouble and get into the weeds is when a well-meaning board member might ask questions of or get involved with operational details, which this particular organization calls micromanagement. So it creates frustration for the CEO and leaving the big picture work. Effective boards do not meddle or micromanage. And so the other point to this is if we have individual board members that reach out to employees inappropriately, it makes the employees very confused. They're like, do I talk to them? Do I not talk to them? Do I do this? Do I do that? And it's not fair to the employees. So it's really important to understand that the CEO manages and the board oversees. That's what we do.
So like, what if a employee gets a hold of a board member?
Okay. For what reason?
Like a complaint? I mean, do they go to the chair or to the CEO?
Well,
I mean, if they follow the chain of command, I
right,
feel like they're not getting anywhere.
right. They should really bring it to the chair,
Okay.
who will
that's
bring
fine.
it to the CEO. But there's a portion of the tool, if you looked at it prior to this meeting, where Ann and I put in an explanation that if the board member receives a valid informational phone call from an employee, somebody that has a complaint that's afraid to go to their supervisor kind of thing, we get them all the time. Then we're gonna ask that instead of trying to address it or ignore it or whatever, is to bring it to the next board meeting, and we'll discuss it in the exec session, and then we'll decide how to handle it with the CEO. Because that is a problem. Because sometimes, you can get a call that says, I want to complain. Okay. My supervisor didn't tell me hello. Okay, get over it, kind of thing, But if somebody's calling and they have something that appears to be something valid, and you got to take them, you gotta take them at their word. And, you know, there's a portion of some of the board training that says you should report that person to their supervisor so they can go the effective ways. But if you have somebody that truly has an issue and they've been to their supervisor, and yes, we have a grievance policy, we should follow that. But sometimes we just don't want to discourage people that think they have a valid reason, you know, to be concerned. So we just got to follow the right channels. Does that make sense?
Mhm.
Very much.
Okay. Micromanagement can be caused by a variety of factors, including a lack of understanding of the board's role, lack of board orientation, and then a board member's interest in certain operational things. So that just means that even though a board may be interested in, say, how the dietary manages, then that board member needs to come talk to the board about, you know, I'm really interested in this. What do you think about it? And the board discusses and decides what to do and what path to take, not just take it on your own. And it's not about control, and it's not about hindering anybody on the board. It's about following the rules and following the right paths so that everybody is comfortable. Plan prior to recognize micromanagement. It's important for the board to have conversations about how we'll manage such instances, which we kind of just did. And we rely on the board chair to point out in direct conversation, empower all board members to identify this. So, you know, when in doubt, not because the chair needs to control, but again, Ann and I talked for 3 hours one day, which was absolutely wonderful. And we said that it's not about the chair controlling what people do on the board. It's about courtesy to the chair so that they know what's going on, and communication strictly. And then you can say, well, this, according to the board, you know, guidance, that this isn't appropriate, or yeah, it's fine. We'll bring it to the board. We'll talk about it and make a decisions. So it's hard to remember that the board works as a unit and not as individuals. And that's, I think that's where, in fact, the whole point of us doing this little training session is because I think in the past, although there's been some guidance and there's actually absolutely bylaws, that there really hasn't been a whole lot of structure around what the board should do and shouldn't do. And also around orientation, because everybody I talked to since I've been on this board says, we weren't oriented. You know, we weren't told this, that, or the other thing. I didn't even know where the ER was for like a year. So it's it's a matter of making a new board. We're gonna have new board members come on next year. So we need to make sure that the board members are fully informed, know what their job is, know what their expectations are, so that they can say, hey, you know, maybe I don't want to do this. Because it really is, for what we do, we put a lot of time into this stuff. And there might be some people that don't know that. So, okay. The other thing is there's adverse consequences with micromanagement.
Can I go back just a tad bit?
Yeah, sure.
So what do you mean by the empower all board members to identify?
Power all board member, where are we?
Right at the bottom. of the-
Oh, to identify the micromanagement
Yeah.
piece. In other
So-
words, the board members should be able to say, the chair shouldn't just be able to say, hey, you know, you're stepping over bounds. Any board member can recognize it and bring it to the board meeting and say, hey, you know, we understand that this occurred, and, you know, why did it occur? And this is what you're supposed to do. And in the future, we need to do such. That's all. But it's not just one person's job to recognize it. It's everybody's. Does that make sense?
It absolutely makes sense.
Okay.
It's just the functionality of it really happening.
Well, I mean, it does more than you think, and that's why this whole entire slide presentation was developed. One, to protect board members, but also
So CEOs and leadership team and employees really know what the role of the board is and the CEO is. Because there's been so many lawsuits in the past 5, 7 years against board members micromanaging. They're going into, I'm just saying, one that I know of not too long ago was a board member was going into looking at billing and pulling records and accidentally got into some patient starts by looking at what the patient was being billed. So that was a HIPAA violation. So, HIPAA violations are up to $1 million+ dollars. It also was looking at CPT codes as well. But then that board member's son was real close to one of the commissioners, and the commissioner's son was going into maintenance on his own at night shift. So there has been so many lawsuits in the past that's really to protect the board members as a whole from a liability or a harassment suit. And that's why these were developed as ongoing educational tools, and really what the board's role really is and what the CEO's role is, so that not only the board knows and CEO knows, but also employees know what their role is, because there has been so many lawsuits in the past about this. There has been so many lawsuits in the past about this.
So so this is a bad question, but so do you think that Dottie, do you think that I could say in a board meeting, can I say, Dottie, I think you're micromanaging? Or,
I would do that in an exec session.
Right.
okay, but so
No,
that's what I'm at. That's why, I mean, I'm not saying that
Sure.
as it's what's happening. I'm asking that if we as board members are free to say that, and how do we say that without offending everybody and causing huge fights?
Right, you would do that in executive session, but that's where this brings a board as a team together to work together for the betterment of the organization, but also for the betterment of the employees, the CEO, but of the outcomes of the patient itself.
Right, and if you think about it, if you do it in a kind and construction way, then it should be something that we could discuss as adults
Right, and that's what you
and
would
decide
hope.
if that's the opinion of all or some or none, or you know what I
Or
mean?
if I'm an outlier,
Yeah.
but I mean, that's what you would hope, is
Yeah.
that you could talk about it as, like you said, adults.
Yeah, we're all grown adults and we all do make accidental mistakes or say something, that somebody might consider inappropriate, or you're micromanaging, or, that's not your responsibility. And we don't want that, because we're all human beings, we're all grown adults. And I don't see a lot of that on here, on this board. I mean, I really don't. I think you got a great board. I think you got a great team, a leadership team. And I think ongoing education like this on a regular basis, as new tools come available from the ACHE, American College of Healthcare Executives, or whoever, I think these are good tools to bring to the board to keep education going and keep the board abreast on the ever-changing rules and regulations, either from the state or the Office of Inspector General. And I've dealt with OIG quite a bit in my career, and it's not that I don't like them, it's that I don't like what the outcomes are when they have to come to a board meeting.
So to reinforce that, the next slide, actually, the board CEO partnership becomes stronger because of, clarity, mutual goals, accountability, open communication, trust and respect, and ability to navigate difficult situations. But that applies to just the board itself as well. That's the way we should be operating. And I think most of the time we do. So it's just a reminder. And then a lot of times, a lot of these board guidelines are always around the mission statement and the strategic plans. I think we need to go back and look at those from time to time to remind us what it is that we're supposed to be working for. But also the next thing is accountable to the mission and focus on organizational sustainability is that effective board understands its fiduciary responsibilities to make decisions in the best interest of the healthcare system stakeholders. And again, that's as a board. The board reviews relevant data, considers, various sides of an issue, makes decisions. And that's another thing that we just talked about, whether it be, something that's going on in the community, something that's going on here, that we sit and talk about it and come to a conclusion that's good for everybody. At least we hope so. And finally, it says the healthy board culture is deliberate about defining its culture. Ongoing learning is very important, which, we try to do every month. Strategic focus, I just talked about. And then there's board standard operating procedures, which is what we're trying to establish, not only for ourselves, but also for the new board members that are coming on board, so that there's clarity around what it is that we do, how we're supposed to do it, what we're responsible for, and what the expectations of each of our roles are going forward. So that's basically the presentation. I was excited to do this not only for us, but also for the admin team and the other employees that attend, so that they can get a better understanding about how a board works as one, and that we're not hands off. In fact, we've been trying really hard to be more visible to the community and to the employees and whatever. So when that rumor came out about you can't talk to the board members, I was like, what? This is like totally against everything that I had hoped for this year, So, and I know where they, things generate here and there and whatever. So hopefully we dismiss that myth. And I would also encourage the employees to come to you guys with questions and bring those questions to us so that we have clarity and open, honest communication all the time.
Yeah, and I think, we have to be transparent, we really do, and this is, it's a learning tool, and I think, yes, election's coming up in a few months, and I do think that part of the election packet, they need to look at a PowerPoint presentation like this, because when they really don't know how much time is involved in being a board member for a healthcare organization. You guys spent enormous hours and time and brainstorming. I mean, it is a hard job that you're not paid to do. It's voluntary, and it is a hard job. But from what I have seen in the last couple of years, you guys as a team, as a board that is currently in place, have done an outstanding job in moving forward in the new era of serving as a healthcare board. You guys have come together as a team. And I would encourage any of you to run again. But if new members come on, I think they have the right to know what it takes to be a board member, how many hours are involved, how many questions are involved, what you do, how you do it, and the legal aspects if you don't follow the guidelines, because it's very important. I mean, it really is.
We just have a few minutes. Is there any questions or comments?
I have one comment.
Sure.
Both comments. I really think that just with this being training and just thinking about that, it would be a really good idea to spend a day after the election and have a training where we talk about it, and not only just training, but also team building thing.
Yes.
And that just real close to after the election is.
Right. And I totally agree with you. And I've been doing brainstorming at 1 o'clock in the morning, 2 o'clock in the morning. And sometimes I might get her to work at 4 o'clock and come with an idea that I write down, and I'll say, you know what? I think we need a board retreat. I think it would be beneficial to
We've
have,
been talking about.
I think it would be beneficial to have the governor here, the president of the hospital association here, and a couple other great people here to speak about not only the board's role, but the future of healthcare. I have a couple of our physicians there. I think it's very important to have a retreat at least every 3 to 4 years. I really do. And it's fun. I mean, it really is fun. But you learn a lot.
And I think they should know when they run, maybe just before, not extensive, but this is what it
These
entails.
are your duties, these are your responsibility, this is it, and I mean, it's a big job.
Okay, before we get started, and I hope I don't delay you guys too much, is that Judd's here. If you didn't see him already. And Judd is with us only until officially Sunday, right? So we asked him to please come up and come to the board meeting so that we could tell him thank you and goodbye. You know, because we didn't get to tell you goodbye before, but, you know, thank you for the job that you've done for us. Thank you for the commitment that you've put in this facility in the time that you've been here. And, Denise, you want to get this stuff? Please.
And I want to thank you for the transition, the expertise on both of us working together as a team to carry on, you know, what has been done, but still still needs to be done. I think we have worked together very good.
Holy smokes. So we have a couple little gifts for you and some messages, and we also have ice cream, cupcakes, and pineapples. Oh, I mean, kind of.
No, I can't get a pineapple.
Oh, come on.
And there's whipped cream over there, and I'm thinking about getting another bowl because that was first thing.
Well, so you should make everybody Sunday. I tried.
I will.
I grabbed ice cream already because I don't like it when it gets too melty.
Yeah, me either.
I know.
And I want to thank all of you. I feel like it was an honor and privilege to be here. And I did my absolute best. I hope none of you ever doubt that. You may not have always agreed with what I did, but I always tried my hardest to do the right thing for Weston County. And I love this place, and I'm sad that family obligations are pulling me away. You know, I'm driving up here today. I'm like, God, I miss it already, you know, because I do. And I agree with you, Randy. I think the board is fantastic. And you all work very hard. You work harder than a lot of other boards I've seen. And your investment into this community really shows in everything you do. And then the employees here, top notch. I mean, yeah, there's some places, some training needs to happen, but the attitude and the dedication and the intelligence and the fact how much they care, this place is blessed. And there's a great opportunity for this place to flourish and become something you can be even more proud of than you are now. So thank you for the gifts. I don't feel like I'm worthy, but thank you for the party.
We hope that you don't become a stranger and that we get to see you from time to time and keep in touch.
It isn't goodbye, it's see you later.
That's it.
Yeah.
So feel free to stay as long as you want. You know, please have dinner or more ice cream.
I'm tempted to do both. I probably am gonna skate because I'm always tempted to like throw 2 cents in, and I don't know if I can stop that yet. So I'll walk away. Just know that I love all of you. I truly do. And I'm very grateful to everything that you've done for the facility. I've learned something from everybody in this room. Lots of some things from most of you. And it's just such a blessing to have been part of your lives or be part of mine. It really, really, truly has.
And we feel the same.
Thanks.
Yes, we do.
Thank you.
Thank you.
Please always feel free to call me too if you have ever
I
have a
will.
question about anything. Randy does.
Sunday at
Oh,
11:58.
Anytime ever. Anytime ever.
Yeah, you can be sure you'll hear from me.
Me too.
I hope to.
Yeah. So have a
Thank
Merry
you.
Christmas.
Yeah, be
Happy New
safe,
Year.
be safe. Going
Thank
back.
Have a very-
you did not bring your motorcycle.
Yeah, I would have more time sitting in the saddlebag.
Let's have saddlebags, yeah.
Send our messages to the family too.
Yes.
I will. Thank you all so
Thanks,
much.
Judd.
Thanks for taking time out of your lives to even do this for me. Thank you.
You're welcome. Thank you.
Later.
Later, as Kevin said, I love. Okay, moving right along. I'm gonna call this meeting to order. Do we have a quorum, Madam Secretary?
We have a quorum, Madam Chair.
Okay, let's start off with the Pledge of Allegiance. I pledge allegiance to the flag
Of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
and feel up to it. Connie, how about you?
Sure.
Fabulous.
Our Father in heaven, we thank thee this day for the opportunity we have to gather together for the good of this community, for the good of each other. We are grateful for our associations that we have, and we ask that thy Spirit will be with us to guide us, to direct us, that we might do that which is needful and that which is best. Father, we thank thee for so many blessings, and especially at this Christmas season, we are grateful for the birth of thy Son, Jesus Christ. And these things we say in his name, Jesus Christ. Amen.
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 Beautiful. Thank you.
That was very beautiful. Yeah.
Okay, first thing I want to tell you is that we gave the employee that we honored this month for the board was Jerry Gray. And if for you that don't know him, he works in maintenance and he's always around. He's, I asked Ron to write a little bit about him. And he said that he's been employed at Weston County since April of 15. He started off in housekeeping and shortly after the transition into maintenance in late June of 15. He's come a long way in his position with Weston County Health Services. He not only takes care of the maintenance responsibilities, but he also takes care of home health chore person tasks, which is no small feat. Jerry has a list of 8 to 10 clients that he shovels and cuts their grass and everything. It's amazing. He says Jerry is your go-to guy if you need anything big or small. He's very soft-spoken and has a heart of gold when it comes to helping others, and he's a great asset to Weston County. And we gave it to him yesterday, not Wednesday, when we were here for governance with Randy and Denise, because he's very shy. And he was, I asked Ron, I said, what do you think? He says, let's do it on Wednesday. So I explained it to, of course, we called him and Denise said, don't worry, you're not in trouble, because that's the first thing. He came up, you could tell he was tentative. I gave him the plaque. I read him the letter. He turned beet red. He's like, thank you for being here. So, we just wanted to be thoughtful of him. So he was so appreciative and really, it just was really lovely. So we congratulate Jerry. Yay. Okay. The next thing is visitors' comments, and Sue Morales is here. She would like to bring up a subject and discuss with the board.
All right, so I am wanting to talk about the influenza vaccine policy, and here's I've got 3 copies. I don't
Got
know.
one.
Okay, here's one. Here's one. So anyway, my concerns are that as of now, it is a it's necessary, required, unless you get a religious exemption or a medical exemption. When I have gotten the vaccine before, I have been more sick the entire flu season. I've had to have more call off more times. I've gone to work with more symptoms. So for me to get the vaccine, it is not good for me. It's not good for the residents. It's not good for the facility. And that being said, I feel that it is kind of punitive for me to have to be required to wear a mask when I am healthy, when I am doing the best thing for the facility, for everybody involved. And so my points that I'm making is that that the people that do get the vaccine, influenza vaccine, can still contract influenza and they can still be contagious, but yet they're not required to wear the mask. Individuals that are unvaccinated do not necessarily contract this virus and are not automatically contagious. They're not contagious from December 1st to March 31st. It's just a punitive thing to say that because you have decided or been granted graciously been granted a waiver, that you're still going to have to wear this. So I just wanted to say that they're not necessarily contagious just because they do not get the vaccine. Current Weston County health policy does not require staff that is unvaccinated for the COVID virus to mask, which is good. But I just think that, so if we're not going to require these people to mask, why do we require people that don't get the flu vaccine to mask? I feel that it is discriminatory. And if you're doing this for religious reasons, which I am, it's religious discrimination against these people to require them to wear masks. So that being said, I am asking, not only that, but on the religious exemption policy, it requires you to say, I agree that I will wear the mask, which it's like I've heard people say, okay, well, I'm just going to check it off and then but I'm not going to wear the mask. I've heard an individual say that. Then I've also had, so it makes for a poor work environment because people that may be discriminated, because obviously if I am wearing the mask, I didn't get the vaccine, people can discriminate against you. Residents can wonder, are you sick? I don't want you taking care of me. And also then in the religious exemption policy, it also says that your supervisor will be made aware and that you're required to. So it also makes there be kind of a tattletale kind of environment. So this whole thing for requiring people to wear the mask is kind of a punitive. It makes it for a poor work environment, and it is not in the best interest of the people that don't get it, the residents or the facility. So I am asking that Weston County, that the Weston County Health Service policy be changed so that individuals getting a religious or medical exemption are from taking the influenza vaccine not be required to wear masks, except in the case of an outbreak that requires the entire facility to mask. And then, so on the copies that I made, there are a few areas that are highlighted. There's just a few areas that need to be stricken out. And part of that is in the policy itself, and part of it is in the religious exemption or medical exemption handout. So I would thank you for my request. And also, so I wanted to say there's many people that also agree with me that do not want to get it, that are not vaccinated. I didn't want to make it a big deal and drum up and say, okay, let's get on the bandwagon and everybody, because I didn't want to do that. I didn't want people to not take the vaccine just because they didn't have to mask or whatever. So it's still a requirement. It would still be a requirement for employment. You would still have to get the exemption. And you'd still have to go through the policy. So I didn't want it to make it a big thing and make everybody kind of revolt and stuff. But there are a number of people that truly don't want to do that and there's another gal that she swelled up so big that she had to, have her line drawn around her arm. And she's like, I'm not going to get it next year. I had a, pretty substantial reaction to it. And so that being the case, we are willing to wear masks if we have symptoms,
Right.
and symptoms that don't require us to stay at home. And I would be willing to take my temperature every time I came in, but I just feel like it's discriminatory to have to wear a mask. Thank you for your consideration.
Thank you.
Thank you
Thank
very
you.
much. I think that
And this is,
I'm Beth Rose. I'm just a part-timer here, but I got really, really sick twice whenever I took the influenza vaccine, to the point that I almost got hospitalized. So I tried the other kind and I still got symptoms. And wearing the mask is really bad for my respiratory. So I really am hoping you can change or modify the policy. It would really be beneficial to a lot of people.
Thank you for coming and talking about it.
Appreciate it.
I think that we need to talk about it further. We have to figure out, where the CDC stands, where the state stands, and, Allison, do you have anything to add?
Allison jumped off.
how
Excuse me,
about you?
Allison jumped off. She'll jump back on for the board governance stuff as it comes later. I
fine.
do know that CDC does traditionally have a flu policy. And I know that Allison or I can get that pulled up as part of the broader discussion.
Okay. Well, we'll take this under advisement and decide which way we go with it as far as discussion and who makes the decisions and
Right.
that kind of a thing. So
CMS almost always has something to say.
absolutely.
Oh, yeah.
Right. And I even remember reading something about even if you had an exemption for the flu, it didn't matter. That the exemption worked for COVID, but not for the flu. But I'm not positive about that, so I don't want to say for sure.
We've had it in place.
Yeah.
It was an exception.
Yeah. See, the thing is if CDC and or CMS have put rules into place and we don't follow them, we don't get paid. So that's something that we'll look at again. And this is your job.
I know.
He's enjoying his ice cream. He doesn't want to be bothered, right?
That's okay. So then when Randy looks into whatever we need to look into, we'll bring it back and we'll make sure you get an answer for sure. But thank you for bringing it to us and, feel free anytime.
And thanks for stopping by my office and review it and discuss it too. I appreciate it.
Yeah.
Awesome. Thank you. Okay. I don't think we have any other public.
You should the microphone.
Oh,
No, thank you.
I don't know if anybody else wants these.
That's perfect. Thanks, Sue.
Yeah.
Okay, are there any additions or changes to the agenda? So please do.
Worrying about it melting over there.
Okay. Hopefully everybody looked at the November 16th minutes and any other minutes that are in there for quality, finance, whatever. So can I have a motion to approve the minutes as a whole?
I'll make the motion that we approve the minutes.
Thank you, Penny. Second?
Dottie, I'm sorry, I was trying to unmute.
Okay.
Before we approve them, there were a couple of problems on the November 16th one.
Okay.
Right under addition and changes to the agenda, it says Leanne Carnegie made the motion to approve the agenda and Ann Slagle, Connie James seconded.
I think
Can we pick one?
Yeah, good idea.
I thought we changed that. Let me look. Oh, it still is in there. I thought you changed that.
Do we remember, we have who it was though, right?
Doesn't matter. I'm sure both of us were saying.
Yeah, well, besides, I have it in my old notes. So, yeah, we can fix that. Carrie,
Okay.
anything else?
The very last motion, it says blank made a motion to adjourn and blank seconded.
Yes, because I didn't get that.
Could we choose a couple people too?
We'll fill it in.
Thank
fill it in.
you. That's all I
Sure.
have.
So do you want to table this or can we approve it and then just fix it?
I'm fine if you fix the record. I just wanted to
Okay.
bring that to your attention.
Approve the
Okay,
minutes
thank
with
you.
the amendments as suggested.
With amendments. Thank you, Connie. And Nick, you still second it? Okay, all in favor?
Aye.
Opposed? Okay, so passed. Thank you. We'll get those fixed by tomorrow morning. Okay. Just send me a note. I'm sure I have it somewhere. Okay, let's move on to strategic initiatives and finances. William?
Well, I'm glad to report we got the cops report filed. Finally,
Awesome.
we have June, close awaiting the audit entries. You know, you always have some entries coming here. And, I tell you, we made a lot of progress getting redoing quite a few things that we had past year. Found a lot of things we corrected. I feel real good going forward now. We changed the way we do contractual bad debt allowances. That's been changed. Updated the financials that way. Working on moving forward also with the Sage implementation, which is a big job. Doing that along with year end with W-2s and 1099. So we got our hands full working diligently on that. That's about where we are. But I'm so proud of we got the cost support in June.
Good. That's good news.
Also, she has on the board there, the money market account, which is not correct. It's good, not correct. Just changed today. We actually deposited another $400,000 in the money market account. So the money market that is another 400,000 more than that says up there.
So what is it, 2 million?
It's 2,475,370,89.
370,89.
Yes, ma'am.
I can, yeah, thank you.
But you know, that's one thing we're committed to, that Cindy and I and Jen's working very diligently to leave the money market alone, to try to build that funds up. I know in the past year we went through a lot of money and stuff that's in the past. We need to move forward. So we're looking at things, we're changing procedures and policies to hold on money longer and build that account. We need to build it up. You don't know when something like COVID comes along again or whatever. We got to plan for those kind of things. So we're doing that. A lot of work back there we're getting done. So hopefully we can continue like that. You know, any questions? I'll be glad to answer those.
So we didn't touch the money market September or October or November, or did we touch it?
Touched it.
November.
We did in November. We touched it in November. So, you know, we'd planned some more. I told we was going to do it. We didn't have to. And I thought the next time to do it again, we didn't have to. But I tell you, Sandy is a watchdog. Don't touch that money, which I appreciate that a lot. We have a good team back there and working together because we all agree we got to build it back there where it used to be.
Good.
Any questions for me? I'll be glad to answer those. But I'm happy with things are going for a change. It's going better. We're improving back there.
Good. Thank you. Let's see where we are. I'm trying to get the minutes up from finance. I know that William did present to us, and you can help me if you remember. William presented us the some of the financials, basically in a draft form besides what he told us today. And then Sandy gave us a report on the AR was down 0.9, I believe.
No, it was up 0.9. Wasn't it? Oh, it's down.
It's down.
It's down 0.9.
Yeah. Awesome. So let me see. I found my minutes. Okay.
Donna, let me say, you know, I did present some more stuff, but I think we need just do the June that's closed because we found some more things. We're gonna make some corrections and stuff. So I feel good about the June financials right now, which we have y'all have copies of there. So working with back there the things we're doing now. So we're gonna hold off to the next meeting to hopefully have July and August at that point once it's closed.
Right. Yeah, we also talked about a finance. I'm going over this again because Leanne's not here. But Sandy did a full report on the AR from professional to inpatient, whatever. And the total accounts over 61 days were up over $1 million, which is up from last month at 49. She added the nursing home financials to the report, which is really great. Piper reported before that, that the inpatient utilization was up. And from what I could see, Piper, is this true? All the other things are basically the same or a little bit lower. Yeah.
From the previous month.
Then we talked about the different projects in the finance committee, the O2 for the hospital, the HVAC system, and here we are with that. The clinic move, which Randy will talk about later. And
It's better than I thought it was going to be when I was hearing about the split.
Yeah. Well, when I talked to Alicia a couple weeks ago, we were looking at maybe 7 tops. But we're up to 9, potentially 10. We had a new kid move in that might be wrestling as well and joining the team now, you know, so a little bit behind the start. So that's going to put us in a problem when it comes to duels. You know, we're not going to win a lot of duels because we don't have anybody over 160 pounds. And so, you know, we're going to give up 40 points.
Right.
In every duels meet. So obviously it's going to be tough to make that up. We do have some good returners.
Well, you get a
coming
couple
back.
of fatties off the couch and have them put the Pop-Tarts down, and
Right?
you can give people a run for the money.
Yeah.
Probably gonna get in trouble for that one too, but
Yeah,
know,
you might.
come on, Heavies, get out there and go wrestle.
That's basically about it. Oh, wait, audit update. Audit's supposed to be done by end of January, beginning of February?
That's what Randy is in January, Randy.
It's January, okay.
Could Randy give us a report about the cost report?
That's what I'm just gonna ask.
I do have great news about the.
I thought
Yes.
those two, and those two,
It's okay.
the issues that Kelly talked about at the end, those would probably be good to tell the whole board or not.
Well, the cost report's done.
Right.
And we will be getting approximately $692,000 back. And that should happen, usually happens the end of February, 1st of March. We should get that check.
And then when we talked to Kelly, she said that it would be good to have, for next year, to have our maps cleaned up and
Yeah.
have the ER time studies done.
Right, ER time studies, the square footage, and there'll be a couple other items that we'll be looking at too, that will help us on the cost people to our benefit as well.
And she also mentioned that it will be really nice that next year we have everything, our reconciliations, all
Yes.
our, everything
It will
up
be
to
done.
date.
That'd be fantastic.
It
Yeah.
will be done.
Great. Then the last thing we talked about was, Jana, actually it was your thing where that you were able to complete all the enrollment. And then it was reported there wasn't enough signups for vision, but then I saw an email later that says there was.
No, there
correct?
was. Yeah, there was.
Yeah,
So the employees were very excited about that.
that's very awesome. So that's basically the report from the finance committee.
It was a good meeting.
Very good. It's always a good meeting. Quality, Kim?
So you've got med staff credentialing. We've got Dr. Peter Bono, he's our pathologist. He's gonna be taking over for Dr. Herr. So he's gonna be overseeing our lab. And then we also have Dr. Danish, and he's with Blue Sky Neurology. There was nothing concerning in either of their files.
That's it.
You have to make a motion to approve them.
Oh, I'm sorry. Well, they're peeking at them. Hang on. Quality committee saw them, so if you guys want to look at them.
No.
I've seen. As per Nick said, first when he looked, he goes, "Oh, he's from Harvard." I know. It was awesome.
I could go however you spin that. I don't know. I could go either.
So can I have a motion to approve these two credentialing folks?
I'll move to approve.
Okay, can I have a second? Second. Okay, Nick and Jamie, all in favor?
Aye.
Opposed? Okay, thank you.
Med staff, so pharmacy, Joy discussed the back orders. She said we're currently doing pretty good with the back orders. She's switching medication manufacturers as needed to keep ahead of it. Before we were low on some IV Phenergan, but we've gotten that in. And racemic epi was on a back order, but at the time we had plenty on hand. But epi, just in general, is on a shortage, but she also said we've got that on hand. She discussed over-the-counter glucosamine. putting it on the formulary. You know, if we have a Manor resident that the family wants him to take an over-the-counter glucosamine or something like that. If we want to put it on the formulary and stock it and give it to the residents, we kind of discussed that, and the providers decided that if the family wants him to have it, that they should provide it, just because it's not a commonly used one, and so it'll be taking up space and money. Radiology, Jamie and Jamie, they're scheduling DVT scans when they're both working so that they can back scan each other and just make sure that it's an accurate scan. They'll start carotid training next month. And then the DMS MRI is coming every other Tuesday. They can start at 7:30 in the morning and they go through the afternoon. Jim in the lab was looking into a handheld beta hydroxy machine. And then Dr. Reimer was requesting a respiratory panel machine that can be used over in the urgent care.
What kind?
A respiratory panel.
Okay.
They'll be a little bit cheaper for the patients. I think right now a respiratory panel is not covered by insurance and it's about $1,000. So this would be a cheaper option. However, it's not so cheap on our end. The machine that he got a quote for was, you know, over $30,000. So.
No.
So he was getting more quotes.
Yeah, I'm sure.
Nursing home report. At the time, the census was 41, and we were waiting on the HVAC system. And there was 3 current contract staff. Home health, I'm still working with Heather. And Heather was working on finishing up the home health state survey, which is done and good, and we're back in compliance. Yep. Seth was working on the tree of love. The ornaments are $25. And he's got his little sign up by the courthouse showing how much they've raised.
How long does that go for? Is it through the end of the year?
I'm not sure.
So it ended last Friday so that they could get the names in the newspaper.
But you can, that's only if you want to make sure that the names get in the newspaper. Otherwise, I think you can still donate and your name will, he's got little ornaments that he hangs on the Christmas tree at the courthouse with in honor of or in memory of. So you can donate, you know, I think through the end of the year.
We discussed the hepatitis B vaccine. Right now it's recommended for patients up to 59 years of age. So Joy was working with the Wyoming vaccine program to see which vaccine that they're gonna offer, and then we'll match whatever they offer and offer it to our patients.
What was the age, Kim? Up to what?
To 59.
59. Greg Foster visited over Zoom about some hospice care that Sharon's Health can do. He said that they're just a 30 to 45 minute drive from Weston County and can accommodate some of our patients if we have any.
Who's he, Kim?
He is part of like the Devotions Healthcare. It's like Devotions Healthcare mashed in with Sharon's Home Health to offer this hospice program.
Is that in conflict with the other? Or in addition to? We don't sign with them, right?
No, we don't have a contract with them.
Okay. But they're available if.
Yeah.
As like an additional option.
Healing Hearts.
Healing Hearts.
Yeah.
Never get
Is
it
this the same one that we talked about like a couple of years ago?
Oh,
Yes, it was the
couple
one that had
years.
approached us first before Healing Hearts did.
Okay, that's
But our signed agreement is with Healing Hearts.
okay.
Christy Lip, she also came in person to talk about smoking cessation options. National Jewish had some grant money out there that they can integrate into our Epic system, and the providers can put an electronic referral into National Jewish, and then they get a hold of that referral and they call the patient and they can do 5 counseling sessions and work with them on smoking cessation. They can get them patches, lozenges, all of that good stuff, and they've updated the way that they do it. You can do your coaching sessions through a chat if you want to, or you can do it over the phone. So they've just added a couple other options. And so Christy was going to look in to see how much grant money there was and how much it would cost to integrate into Epic. And then we already did credentialing. Quality. We went over our incidences for the month. We talked about a discharge issue that we had with Wyoming Medical Center, some miscommunication on that. We looked at our new vendor fee trail, some of the survey response rates and the results of that. I can run a bunch of different reports. It's just a matter of getting that data into there. It's been live, I think, about a month now. So we've got 200 and some responses. So it's doing good. I'm able to on this one, which is nice. I talked about I can run a report based on age, so we can see the majority of the age that's responding to them. Because I know there was concern before that some of the older population don't do text, but when I actually calculated it out, the older population is the ones that are most returning the surveys. Yeah. We talked about our current number of temp staff. Melissa has over in the long-term care right now 2 CNAs. She's got 2 more coming at the end of the month and 1 more in January.
That's down from 11, right?
Mhm. Yeah, that was, yes. Infection control in the hospital, we're seeing a lot of increases in outpatient positive COVID. And all of a sudden about 50% of it's positive, coming back positive. Haven't seen any RSV yet, but lots of respiratory things going on. Our ED wait times were down significantly this last month, so that was good. Home health just working on their medication recs and then their CNA oversight, just tracking that. Pharmacy, Joyce said she had an increase in end-of-life medications and an increase in outpatient infusion, so that's been keeping her busy. And then we talked about AR being down 0.9 days. So that's it.
Hey. Jamie?
Nothing. We did like the food travel, the survey. That was pretty exciting. And I think
It's amazing.
incidents were really decreased, so good job.
Okay, let's continue on with old business, radiology update. Randy, I think it's you, Keisha's not here.
Yes, so Keisha and I have been working on the capital budget equipment for the new radiology equipment table. So we've been working with 3 vendors. One's Philips, the other one's Siemens, the other one's GE. So we're still getting pricing on those. And as the pricing comes in, we're working with our GPO, our purchasing organization, to get them pricing down. Once we have that complete, we'll discuss that and move that forward to the board to get the board approval to move forward with that capital purchase.
Okay.
On the Sage Intact update, the training is complete, but we do have additional training on different segments of the Sage. And then I will be talking to the leadership team to see, pick 2 or 3 super users. And I'm not going to throw any names out there, but I think Piper will be one of the great super users. So always like to have 2 or 3 super users just in case. So when we have additional personnel come on, that they have that training and ongoing training to use that software. Same will be for the Epic as well. We'll have some super users for that as well. On the HVAC update for the long-term care unit, we didn't get the additional funding because we fell short of getting the additional information to the state. We do have some grant money that did become available to us. That was approved for about $1 million, but the total project is around $1.7 million, which our portion would be about $550,000. Right now, as it stands, working with the current architect that we have, I think it's in our best interest as an organization, but looking at financials and everything else, is to, I had talked to the state, go ahead and apply for another grant in 2024. And in the meantime, to satisfy the needs for the long-term care, go ahead and continue working with Ron, our director of maintenance facilities, but also the architectural firm to put in 2 4-ton units with the piping and fix the duct work. Now the architecture firm is talking around $70,000. But what I would like to see us do is go ahead and rebid that, get 3 bids instead of 1. I do not like 1 bid on anything. I like to receive 3 bids, be consistent, be transparent in what we're doing, and then move forward from that, but act quickly on that. But as a board, be judiciary cautious on what we do, how we do it, and as soon as we do it. I think 2-ton unit, 2 4-ton units with the piping and to fix the ductwork. I think $70,000 is way too much money. I mean, if you look at the cost of 2 4-ton units, they're not very expensive. If we buy them ourselves and get premier purchasing pricing, and then the piping is very cheap, and then fixing the ductwork doesn't look like it's going to require that much work. And talking with the architect and, you know, them being a little bit belligerent, I said, I think it's in our best interest, whether we have to go to the state of Washington, Colorado, to have somebody, even if we have to fly them in, if we're going to save $30,000 on the 2 4-ton units and the piping and just to fix the ductwork, it's in our best interest to go ahead and bid it out and get 3 more bids. And that's the way I like to work. That's the way I like to operate. 3 bids, not 1. So when we get that information, we'll bring it to the board, and so we can get the board approval and get this complete before the weather starts hitting, so that we have cooling and for the long-term care. But then also go ahead and apply for another funding through the state on the grant for the rest of the facility. Go ahead and fix a total HVAC, because usually what we're looking at is really the fan coil units that's outdated. Any questions on that?
So you think that for less than 70,000, we can get it fixed to what we need so that people aren't. there
Right, for
without-
right now, yes, yes. Yeah, I think we're probably gonna be looking through, if my calculations are correct, from an engineering standpoint, I think we're looking at less than $30,000. I really do. Even if we get 3 bids and what we're looking at, 2 4-ton units with the piping and that little bit of ductwork, 70,000 is went over the top of my head.
What do you think the time frame is?
Excuse me?
What do you think the time frame would be?
I think if we get pricing in January from the 3 people that's gonna bid it, and we review it, I think by February, present it to the board, and the installation will not take more than 3 weeks. And that includes fixing it up. I did my due diligence and looked at everything. It's fairly simple.
Excuse me, I can't figure out how to raise my hand on this thing, but are we talking about replacing the $1.7 million project with a $30,000 unit?
No.
No.
Okay, all right.
This was, Carrie, this was the estimated cost of the project was $1,691,308,000. And our portion would have been $541,958,000. And the foundation.
And you're talking about replacing that with a $70,000 unit?
Doing baby steps and fixing the big portion of the cooling right now for less, probably about $30,000 in the areas that we need the cooling immediately. And then applying for the new grant for 2024 for the fan coil units. And then applying that towards, towards 3 proposals that we should have gotten in the past instead of 1 on getting the work completed. Does that help any?
So
So
this
it's-
is like part A.
Yeah, part A, right. So if I'm not incorrect, the $1.7 million was for the entire project.
Yes.
This 30,000 or whatever it's gonna cost us is a part, just like Connie said, part A. And then the applying for a further grant is to finish the job.
Correct.
Is it just cooling or is it cooling and heating?
Excuse me.
Is it just cooling or is it cooling and heating?
Now, this would have to do with cooling because the complaints are the cooling for this particular unit, for this particular area.
So the heating is working okay right now.
Yeah, the other with the fan coil units are heating and cooling.
Does that help, Carrie?
It makes me more confused though, because I thought our immediate problem was we don't want our residents to end up without heat. But it sounds to me like we're scrapping the heating project and hoping that we still have heat, but we're gonna address a cooling problem, which we don't have, with a $70,000 unit, but we're still not addressing the fact that we might end up without heat. Am I correct on that, or am I still lost?
No, I mean, we do have the cooling problem right now. So the weather's gonna be coming up, say in April, May, warmer weather. So we need to really address the cooling problem with these 2 4-ton units with the piping and the damaged ductwork. And then with the fan coil units, which is mostly the cost of what was proposed for the grant money, then we would apply for a new grant, but receive 3 bids instead of 1 bid from the architect and the contractor.
I think what I hear you say is that we had discussions about that there was a problem with the system heating and cooling, that if it crashed, we were in trouble.
That is correct, if the entire system crashed, but we would be more in trouble if we don't go ahead and move forward with this cooling, because when the sun is beating down in these common areas, it gets really hot. So this was, when I was talking to Ron and talking with the architect, this would be a quick fix. And then we would have reapply for the 2024. I know the architect wants to go ahead and do the entire project, but it's my duty to protect the hospital from spending as much money that we don't need to spend right now, because yes, the heating and cooling with fan coils need to be complete. But is it going to fail today, tomorrow? No, it's not going to fail today or tomorrow or 6 months. With talking with the architects, I mean, he was getting really kind of obnoxious and moving forward with this. And you know, as I told him, it was my duty to protect the hospital, but yet provide good quality patient care in a great atmosphere. But I said, if we're going to do that, then we're going to resubmit this out for bid for three bids instead of 1, just because that's a lot of money, and I think it's above what I see from an engineering standpoint for the project that I actually would bid out for. It's way too high. Should have had 3 proposals. And if worse come to shove, if the system would fail, which I don't think it will, we can have Train or Siemens bring in portable units at a minimal cost to have sufficient heating or air in the area.
Any other questions, Kara?
No, actually, Madam Chair, I'm gonna let Leanne fight this one because I have a feeling she's gonna go ballistic.
I think she already knows.
What's that?
Carrie says she thinks Leanne's gonna go ballistic over this proposal, but I said we talked about it in finance.
We did, yeah.
Yeah.
What was the major problem initially? Like what's just, and I have it in my notes somewhere, but what is wrong? Especially because like I said, it was like, now this needs to happen ASAP. We need to get the heating done. And then now it's kind of pivoted to, we just need, I just want to know more.
Well, if you go back and you look at these fan coil units
Yeah.
and the time frame they was installed, I mean, they're old units. And I found this in many organizations, many these units last for 80 years, 90 years, because they were well built. But the copper on them, when you have water treatment flowing through these units, so the copper starts getting thin and thin. Then eventually those bust. So you have to go in and repair these, put new valves in. I mean, that's the only thing with fan coil units. Nothing really happens to them bad. Either the fan goes out and you can replace the fan very cheap, or the copper gets so thin that it busts because it's a closed loop system. But then you just valve it off and you fix the copper, or you put in a new motor. That's really all fan coil units are. So, you know, if one goes down or two go, if 10 goes down, very, very, very rarely would 3 go down at one time. Very rarely. I don't see the big issue as a time frame with these fan coil units. I really don't. I worked on these back in the 70s and 80s. When I was doing some consulting work out in Seattle, Washington, a few months ago, we looked at these same units that were in place for almost 100 years, and they're still running. Are they having trouble? Sure, the copper's getting thin. They'll have to replace it. The fan motor on the bottom, some of them have one, some of them have two. They replace them because they get clogged with particles and dust and everything else. But it's just changing those out, getting the parts. It's not really that hard getting the parts. It's just a fan motor. So I really don't see a immediate cause to just jump right in and spend $2 million on these fan coil units. When you, like I was telling the architect, you can do them in baby steps if you really wanted to. You can do 5 rooms in 2 weeks if you want to, or 5 rooms in 5 months. But I think from a cost perspective, and what I like to see, to get 3 proposals from 3 different contractors, fixing the cooling right away and the piping and the ductwork is in our best interest. I really do.
I think the question is that we were told that this was critical to get done. And so now is it relooked at and there's a new decision? Was it an architect push? Was it, you know what I'm saying?
Yeah, and
that's why it's confusing.
Yeah, it is confusing because it was confusing when I was talking to the architect. I think we really need to revisit, get 3 proposals, know exactly what we're looking at from a system perspective, because I know fan coil units from head to toe. I can go through, I can measure the air exchanges per hour in each patient room. That needs to be at least 6 air exchanges per hour per room. And we're at that right now. So I don't know the big push. Only thing I know, he was getting a little arrogant on the phone. And I just said, you know, I am the CEO. I do answer to a board. And it's my fiduciary duty to protect the organization. And this is what we're going to do. And I will get back with you after the board meeting that we have.
So surprised at, like, I hadn't understood the finance, that it wasn't heating and cooling. So that wasn't, but I like what you're saying about doing it in pieces.
Does that help out a little bit, Karen?
I guess I'm confused because we were told that the units that we have are on their last legs. You can't get parts anymore, and they're actually stealing parts from the rooms that are not being used to power the rooms that are being used. So we're like duct taping and band-aiding the units that we have. But now you're saying that it's not a problem and we don't have a heating problem anymore. It's not on its last legs. I guess I don't understand what changed so drastically that we no longer have a problem.
I'm not saying we don't have a problem. There are some problems with the fan coil units, but working with working on fan call units. I mean, you can get parts. Will it take a couple weeks or 3 weeks to get parts for these units? They're still readily available because they've been around for 100 years.
Okay.
You know, I don't know the back issue with all of these and how they was presented to the board. I know Ron and I talked about it. We talked about the 2 4-ton units and moving forward on that aspect. And I talked with the architect, like I said, that I think we need to revisit this. And it's not that hard to revisit. You're looking at fan coil units and you're looking at 2 4-ton units to put in for cooling with fixing the ductwork and the pipe. It's pretty simple. I don't know how it was proposed to you guys as a board from the architect or the contractor, but I think,
We didn't see them. We didn't see
didn't see
either
them?
one of them. Nope.
well, only thing I can say as the CEO of the organization, I think it's my duty to protect the organization. Get 3 additional bids instead of 1. You guys have been working with the same contractor and the same architect for 15 years. I think it's time that we get 3 additional bids and do it relatively soon and present that to the board and why it is such a project that needs to be done last month.
We agree on the bids because we were told that there was no other bids. So you see where there's some confusion.
Yeah, I mean, you've
Yeah.
got contractors in Florida that would be willing to fly here in the state of Washington, Montana, you've got Canada. I mean, it's not that big of a project. And when you mention fan coil units, any engineer will know what a fan coil unit is. I mean, it's not rocket science.
I thought I just saw heating and HVAC thing around it too.
And like I
We
say,
try and get bids within the state.
Yeah.
I mean, that's what we like to do locally as best we can.
right,
But
exactly,
if that's not available.
right. Then
Well,
you
at
just go
least-
outside. Yeah. And if, you know, if that system, any system can go down anywhere. If you put in a brand new heat exchanger, that thing can go out the next day and you're gonna be down. And the same way with these fan coil units. So if that does, you bring in you have Siemens or you have Trane, bring in portable units, pump in the air, make sure air exchanges is per hour is correct up to the state and CMS level at, you know, in them rooms, it's 5 air exchanges per hour, and then you're fine. I mean, so it doesn't matter if it's the fan coil units or a brand new heat exchanger that you put in or induction unit that you just put in. Those fail, and some of them that I have put in the past may have failed 2 weeks due to factory installation. And it happened in surgery before. You bring Siemens in, you bring the portable units in. If you need them for 5 months, they are right air exchanges per hour, and you're fine.
Any other questions, comments? Okay, thank you. Denise, social media?
So in the packet, you will see, and I have Piper, I made a list and Piper went over it for me and added some more Facebook pages that I get information from, and I'm not finding it. Information from to be able to share on our Facebook page. So I go to the CDC and those things, and so I would like an approved set of Facebook pages that we can share from so that it stays consistent.
Right, so we approved this policy already before, but Denise had the gall to be in England. So she said, oh, but it wasn't complete because we didn't have this list of preferred or approved providers. So she just wants to add that to the policy. So you want to pass it around? Okay. And then we can re-vote just to add it.
Some are local and some are national.
And how did you come up with these?
So a lot of them are the ones that I've been using. So I had gone to like Angie and different people to ask where I can get information from. So it's just ones, most of them are ones I've used. All but the ones Piper wrote on are ones that I've been using for years and been sharing already.
And they're ones that you have. Yeah.
So in terms of policy annually, it has to be reviewed. And that would be when changes could be made,
Right.
or I suppose at any point in time, but. Basically, it's a motion to approve
Addition of the list of providers.
pages to the Weston County.
Yep.
It's out there.
Thank you, Connie. Second,
I'll second.
thank you. Any discussion? All in favor?
Aye.
Aye.
Opposed? Thank you. There you go, Denise. Can add it in. Okay, 340B update, Randy.
Yeah, so on the 340B update, I've been working with Joy. Joy's been providing me some information with statistics, and Piper has well too, with prescriptions, and Travis has too. So with what I'm working with one vendor right now, Joy and I, that would actually come in, set up the 340B program and move forward. And you know, it's not, I've heard rumors since Joy and I have been talking about that. Oh, they're hiring a full-time pharmacist. They're going to take our place. It's going to be additional FTE. No, it's not that way. So the people that own this company are pharmacists or past pharmacists. So what they do, they come in and they set up this program, and very little cost, and more information will be coming to the board as to what they do, how they do it, and what their percentage that they take away. But they do all the work. You know, anytime you try to set up a 340B program in your own establishment, it's a lot of work. So you're taking all that work that should be focused on patients, whether it be retail or in-house patients, away from the pharmacist. They do all the work. They bring in the machinery. They do all the paperwork, all the files. So I'm looking at to get another vendor in, and once we do that, and we get pricing together, and we look at everything, and they come in and they do their presentation to the board, then we can act on it and move forward with it. That's the way I've always done it. That's the best way to do it, and let them do their presentation to the board, and the board gives the blessing on either one. Then we move forward with it. Well, it helped. Yeah, it will bring additional revenue in. And will things be cheaper for the members? Yes, they will. Are we going to increase our pricing on the medications right now to the public? No, we're not. We have not done our due diligence on whether we're going to increase the pricing, leave it the same, or lower it. So it's in our best interest to look at it from a strategic plan on if it stays the same, we increase it. But no, what the paper said was wrong. We are not increasing those prices.
So it's a contracted service.
Right.
Any questions about it?
Was it the 340B that is going to cause problems with us not having the clinic and the hospital under the same?
It will fall under the rural health clinics mainly. Very little, depending on the type of patients you have on the inpatient side. And then I would like to look at different perspective models within the community as well. Whenever we get the information from the 340B vendors, I think from a political standpoint, I think it would be good.
Okay, clinic update.
Clinic update. So on the, on the clinic update, yes, I do agree. We do need to move the clinic to the hospital. Should we do it now? No, I don't think we should do it now. I think, with But the cost of the renovation for the clinic we currently have, I think we would be wasting our money from a liability issue with the way that clinic is actually constructed. And then with the drive, I mean, y'all have been over there during the snow. I have. I've helped patients out of the car and up to the sidewalk because I was afraid they were going to slide down, end up out in the highway. So, I mean, if that would happen, a patient would get killed, you might as well close the hospital because you're going to be sued. You don't have enough money. And looking at insurance policies we currently have. And I have talked to the medical staff. I talked to them this morning about it. And yes, they would like to see the clinic move to the hospital. So I think that needs to be our focus. I think a strategic plan needs to be put in place. Look at and then move forward from there. See what the pricing is, see what our best options are, and get it to the board ASAP, and then go ahead and move forward with applying for a grant for that type of situation and moving the clinic to the hospital.
Because we have to reapply.
We would have to reapply. I mean, there's two options that you can look at. So if you move it to the hospital, you do the construction inside, this, that, and that. I'm just hypothetically throwing things out. That so if you move it to the hospital inside the hospital, so they start construction, but before they start construction, you need to look at, now it's 2024 or 25, so you got to bring everything that you have done 5 years ago up to code. So whatever was proposed before is going to increase about 45% because of bringing the hospital up to code in all the areas, whether it be HVAC, air exchanges for our generator load, all of that would have to be brought up to 2024 or 2025 code. And that's very expensive. So I think we'll have to look at our options when we come to that and see what they are and see what best fits our needs and fits our pocketbook, per se.
Questions about that? No. Okay. Now we're moving on to new business with the HVAC heat exchange.
Yes, we had a heat exchanger bust and
The hospital side, right?
yeah, on the hospital side. So this happens. Now, this happened about 5 months ago out in Washington. Brand new heat exchanger that was put in. Tube bust. I mean, sometimes it's because of water treatment, sometimes because of not water treatment. Sometimes you can plug these tubes. Well, in this case, no, you can't. I spoke with Ron. We had a couple of people come in and bid on it. I mean, it's something that we really need to act on pretty quickly because we're going to need heat because right now it's warm. So, I mean, he got it down from 70,000 to 50,000, but after looking at the insurance policy that we can apply a certain percentage that I looked at, about $15,000. So that's going to bring it down to about, hopefully get it down to about $35,000. And I think as a board, we really need to go ahead and move forward with that price. Once I'll get the proposal from the company to you guys, and then, you can vote on it. But I think it's in our best interest to go ahead and move forward with replacing that before it gets really, really cold. And I'll get that proposal to you, but there's no fixing this heat exchanger. There's no plugging tubes or anything. It's busted. It's done. It's seen its better days. I mean, heat exchangers usually last anywhere from 5 to 25 years, and this one's over 5 years old. But like I said, I've seen heat exchangers just explode in 2 months just because of the chemical that was involved. So, it's unfortunate, but we do have a little bit of insurance on it. So that's going to help with the price. And, that's actually a pretty good price. I've seen heat exchangers up to $90,000 of this size. So I think it's very good.
What's the time frame on this?
Well, the time frame, that's the problem, would probably be about 60 days in getting it installed.
So how many?
Right now, we're all right. Yes.
Do we want to wait till January?
No, we don't. I mean, we can get the price to you and you guys can either call a special meeting or do a Zoom meeting, vote on it. Yeah. And we would take that from operations. We would not take that out of the CD or the money market. We'd take it from operations.
Do you want to wait for the bid or do you want to do what we sometimes do and have a vote on a certain amount?
Yeah, you can do that. You can go ahead and vote on, say, okay, no more than $50,000, because that's what it is right now. And if it comes in at 30,000, we're good. If it comes in at 44.5, then we're good. I said, but no more than $50,000. I would go ahead and vote on it for no more than $50,000. And we'll do our best, and Ron will too, to say, hey, no, we're not spending $50,000. You need to come down to 38, then we'll apply the insurance. It's gonna be even lower.
Well, and if it comes back higher, then we don't do anything, then we reconvene.
It won't come back higher.
Okay, I'm just saying.
Oh, I know. I'm very conservative.
So what do you guys think?
I would move to 50,000 tops.
Limit.
50,000 limit?
I'll second it.
Ian, second it. Any further discussion? All in favor?
Aye.
Opposed? No, so it's approved.
Thank you very much. Appreciate it. And Ron will too.
Okay, education plan?
Yeah, on education, I've spoke to not only the leadership team and management team, but physicians as well, and they all agree. You know, we all need education. I need education on an ongoing basis, and I do. Whether it's through the American College of Healthcare Executives, American Academy of Medical Administrators, or if I go to a community college and get updates on Excel spreadsheets or whatever, or leadership development. I'm a firm believer with CEOs getting leadership development because it's ever changing in the healthcare arena. So, you know, even with housekeeping, and the laundry people that does all the laundry, CDC rules change on the temperature of the water, how much chemical you use, personal protective equipment, on up to nursing with continuing education and acute care side, on the emergency room side, RT physicians with continuing education. So that is a big thing for me, and as well as boards. You know, with board education, I think with education, we can move forward. Without education, we're going to be at a dead stand. So education is a big thing. It doesn't cost that much for, you know, whether it's a seminar, or online course, or it's a WebEx. We all need that education in order to move our great organization into the future of healthcare. And I think it's very strong, and I will push it, and we'll keep the costs down. Then a lot of that we can get from, you know, the Wyoming Hospital Association, American College Healthcare Executive. But you have vendors come in like Siemens, the educator, or GE to educate the staff in radiology, and it's the same for your other clinical department. They'll come in, they'll do an in-service, even maintenance, like Rangers or somebody will come in and do an in-service on fire penetrations or smoke penetrations, or how many air changes per hour do you need in your common areas, or in your, or say we don't have surgery suite, but surgery suites, or in your patient rooms, things like that. So I'm going to push education.
Is it not currently in the budget? I mean, I'm assuming.
There's time in the budget, right? But I'm just saying, from an organizational wide, I think we need education in every department, and I think, you know, they're aware of that. But I just think in order for us to move forward, for the best interest of the patients, education should be one of the top priorities if we're going to sustain ourselves and be transparent. Any questions?
Questions, discussion?
I guess I was trying to figure out what the plan was.
Well, that's what I'm gonna put together. I mean,
Okay.
I wanted to talk about a little bit and then put like a plan together for each department, but also get the leadership's input and management input on what they would like to see in their particular department, whether it be human resources, quality. I already talked to Kim about some education on her part from a quality perspective, you know, and then we want to look at risk management, and then we want to look at other departments, and then look at positions as a whole as well, and see what we come up with and plan for each department, whether it be HR, maintenance, housekeeping, administration, I don't know why I want to call you Jeannie. Denise and I. That was my last administrator, but something like Jeannie.
Was she
Right. Okay, I can't.
Not as good as
Anyway,
you.
not as good as you. So, yeah, it'll be good.
You were basically just giving us a heads up.
And I think that I'll put this on the agenda for next month, so we can talk about what the board would like to be educated on. Come up with some topics so that we can make arrangements to see what we can do besides a retreat, which is top on the priority list.
Yeah, I think a retreat for you guys would be just a blessing. I mean, I really do.
Me too. Okay.
Yes, I would like to introduce Miss Donalda Bennett as our new interim Director of Nursing, Director of Patient Care Services. She was selected by the leadership team right now at the interim. We are currently interviewing other candidates as well. So I think within the next 6 to 8 weeks, we'll have a permanent candidate. And, you know, we never know who we're going to get since the interview processes. It kind of was at a dead still for a while until we got some additional internal candidates. So we've interviewed a couple more. So wait a couple weeks until after the holidays and see what comes in and move forward from there. But right now, Donalda's the interim Director of Patient Care Services, DON. So we welcome her and an honor to work with her.
Let's focus on that big huge stuff.
And it's switched, so you're not on call all the time, right? Is it?
Anne's asking about people being on, does she have to
Because
be
you know
on call?
when Angie quit,
She will be on call. She will take like we do. So we share administrator on call. So we rotate. I think there's 4 or 5 of us that rotate on a weekly basis that just take administrative call. So like, you know, I would take it for a week, then she would take it for a week, and Piper takes it for a week. Then we just kind of bounce it back and forth. And it's a great thing. And
That's what I was making sure.
yeah.
Yeah. We're protecting you. No, that's great.
You just never know what, you know, I heard that, but who's to say whether it's
Right. Can you put this document up for me, please? Okay, we're gonna go to other reports and we're gonna start with governance. So we're gonna go back to the document that we talked about the last time. I'll just give you some insight. As you know, we decided to table it because Ann had some concerns as well as others. And that was the only fair thing to do, because as I said before, we all have our own opinions and ideas. So basically Nick met with Ann. Do you want to talk about that at all?
No, it was great. It's just one of the things that I had mentioned at the last meeting was that I just want to hear and see what Ann,
Is this the right one?
what Ann was, you know, what she saw, and then just sat down with her and we ironed out a lot. I thought it was very fruitful and very productive. So I think we met for about a couple of hours and just got on the same page with it. So yeah, no, I thought it was very, very, very good session.
Awesome. So then Ann and I, right after that, met for 3 hours and we went over this document word for word. And so, you know, we're going to name it, and I'm bothered by this though. Training tool for new board members onboarding this is really an onboarding tool for new board members, but also a refresher for current board members. You know, it's a training tool. So I just want to make sure that that's clear. I don't like the title. I'm going to switch the words around a little bit. So one thing I want to make clear is, first of all, the governance committee started this document from scratch with a whole bunch of input, not only from board.com and other various things that we found, but also from Mary Martin, who is the exchange educator for the Wyoming College, which also worked with the commissioners for the same exact reason. So as I mentioned the last meeting, we had a board meeting with Mary, and unfortunately only 3 people could show up. And that was fine. So Mary went over all of our bylaws and the document that we had started with. And it's been said that this is my document, but it's not. I'm just a typer. Okay. So at that time, Mary said, you know, the document is really great. However, it needs to be wordsmithed some. So she offered to come and sit with me, the typer, to wordsmith the document, okay? But she gave us great praise that we were actually implementing something like this to give some structure and guidance to our board because it was like the right thing to do, and she was very excited. And she actually said that when we were finished with it, that we could actually publish it if we wanted to, because it was that comprehensive for guidelines. So in the meantime, when we presented, this is a little history. When we presented this to the board last time, there were some questions about what was the purpose of it, and also some of the language, which, you know, basically that's what Anne had a problem with, is some of the language and what it actually connotated or could connotate.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
Some of the language, which, you know, basically that's what Anne had a problem with, is some of the language and what it actually connotated or could connotate. So we went back, and there's very few changes to this. So if you go to the first, you can see the changes in this document, but not with the comments in the column on the side. But really, we changed bullet number 3, direct supervisor to primary liaison of the CEO, and that's per the bylaw language, okay? Then we also changed primary liaison, then the last bullet, took out the CEO because we already know that. Other executives, other board members, legal, I added because we forgot legal. And media and stakeholder groups and community. And so what that means is that the explanation that I put in that comment says, if a board member has a need to discuss any board-related information with an employee or anybody else, they should contact the chair in the name of, as I stated before, clear communication and courtesy, so that we're all on the same page. And also to see if it was board initiated. Yeah, we have no, it just reiterates what we said earlier in the slides, that we have no responsibility with the employees. And so it's the CEO that we have to run everything through. So, and the primary contact is the chair. And again, as I stated before, and I'll say it again, it's not because of control, it's the way the process works, okay? So if you keep going down, the next bullet we changed says, lead the board meetings and encourage the board to work as a unit. Because we know that we can't control people and how they feel and what they do. So encourage was a really good way to describe it, I think. So.
Because none of us can make us work as a unit if we don't want to.
That's right.
doing
We
that
can't
with
make
kids.
anybody do
Right,
it.
exactly.
You can't even do that with your kids. So the next one was organize board orientation and development. And we took recruitment out because that's every board member's job, not just the chairs, okay? Then we took out the last 2 bullets because they just seem to be repetitious. So we don't need those. Then we put, actually, I have to tell you this, I just found this just today, actually. This said the board chair was the ex officio member of all committees. We took it out because the bylaw says CEO, but it does say chair in some documents. Not our documents, but outside documents. So it's a little confusing. So I guess it could be either or, I don't know.
But our bylaws say the CEO.
It does, and that's why we changed it to that. Keep going down. We changed the committees a little bit to make it a little clearer. as far as we have standing committees, which is governance, finance, and quality. And then we have special committees, which is ethics, foundation board, and then the joint conference committee with med staff. So that's a change there. Then we go down, secretary was good. Treasurer, the treasurer part, it said, Mary said that it was the treasurer that oversees the CFO. It's not really that. And we took that out, and we actually took that out because the bylaws doesn't say that either. But ensure proper oversight of the hospital finances and fiduciary responsibility. But Ann and I decided that it made sense to add along with the finance committee, because you have the treasurer that has that oversees the finance committee and the finances, but we all oversee the finances in some way, shape, or form. So if they work in hand with the finance committee, which then brings, along with the CFO, the finance committee brings the information about finances back to the board to make decisions and have discussions. So as you go down the bullets where it's appropriate, we added CFO and their staff with the finance committee. And then the last bullet, we added the treasurer with the finance committee ensures essential financial policy and so on. If I'm going too fast or you have something to say, please stop me, please. This question in here, oh, no, it's the first, the top. I'll get back to that in a minute. I wanted to ask Allison or Nick something. This one, the trustees will sign and read the conflict of interest policy. We do that when you get elected and you come in. Bullet number 2, serves as the governing body of the hospital, setting clear objectives, and serves as the direct supervisor of the CEO. That's all board trustees now we're talking about, okay? The rest of it was good. Then we go on down to duty of loyalty. Now, when we got to duty of loyalty, obedience, and care, we noticed that Mary had given us the statement of what they are, but not the definition. So we put the definitions in, so it was easier to understand. So duty of care was fine, but duty of loyalty, it's the organization and the stakeholders come first before any personal interest, and that's it in a nutshell. When we looked at the definitions, even the slides that we did earlier, it goes into all this explanation, but that's it in a nutshell. And then duty of obedience, she had initially said it was legal responsibility to comply with federal, state, and local, but the true definition is respecting the limits of the board's power and using that power to help the organization fulfill its mission while also respecting and obeying all laws, state and local. So we thought it was better that we had a definition so that when you read it, you're not scratching your head. So then I talked about this earlier, where it says support all policies of the board and avoid interfering with operation of the hospital, which means also avoiding gossip and blah, blah, blah. That's what we said, that we didn't really need to say that. We just need to say that everything that we talk about should be truthful. And that if there is gossip or innuendos going around, that we just don't carry it, we don't support it, and always tell the truth. Because I will never forget that Ann said to me, the truth will always win. And she's absolutely right. So we are encouraging truthful communication, but also go back to the conversation where I talked about valid informational calls to the board. You know, if it's not truly a true grievance situation where we reach the policy, that we should bring it back to the board and discuss it and then come up with a plan so that we don't have a whole bunch of stuff going around about nothing. Because I could say the sky is blue, and by the time it gets around this table and down to Kim, the sky is purple with polka dots. You know what I'm saying? It's just crazy. So that they were the changes that we made to this document. And so I'm asking, you know, I had sent this guy to you guys 3 weeks ago about to look it over and make comments or whatever. And I don't mean that this is a fault, that I hadn't heard anything. So I was hoping that no news was good news. But is there any further discussion or comments on this document too?
Just a question. Where will this be placed?
It'll be placed in the folder in SharePoint under board orientation. At least that's where I would recommend it go. Because in addition to this, the governance committee will continue to work on whatever is in there that we don't need, get rid of it. And also, update things that are there that are relevant, and then add things that we don't have. And then remind me to go back to that topic too. But anybody else?
So I still, it still bothers me a little bit, this primary liaison for other executives media. That is kind of true. I just don't want, like,
What are your concerns?
going back to the deal where we can't, where us as board members can't talk to other employees or things like that.
About board issues.
Right, and so, which I don't know, that's the hard thing to.
It's a
Well,
fine line.
It is a fine line, so, but it comes from a legal perspective, so if you're talking to employees about board issues or things that were said in executive session, so that's where you get into a liability issue. Now, if it's said in open session, you're not, but in the executive session part, or if you're in executive finance committee, that's where the legality and litigation comes into effect.
See, because what I don't want is I don't want, so, you know, when the first one of these came out, I felt guilty walking into Judd's office and talking to him. And I don't want that. I don't even want, so that's what I don't, that's like, I don't want to have to feel like I have to sneak into Piper's office to talk to her.
Right.
You know what I mean?
Well, that's what I try to dispel at the top of the
Right,
meeting.
I know.
Is that, you know, you can talk to anybody you want to, but when it comes to board issues, that's where the no-no is that the board issues should be discussed by the board, decided by the board as a whole, and then discussed as a board as a whole.
So do you mean board
Are you
issues or do you
concerned
mean
if you
executive
ask,
issues?
if you ask a question of one of the employees that's not being allowed? Is that your concern? 'Cause I don't think it is.
Yeah, that's, I mean, sort of. I mean, I just want, I don't want it to seem like it's improper for me to walk into Kim's office or anybody's office, even if it's for any reason,
But it's
really.
not. As long as you're not discussing board issues, it's totally fine.
Or making a decision.
Or making.
Right.
This is what
That's what,
you need
that
to
to me
do.
is what would be bad if I was.
Right.
But then, and see, and the whole thing, the whole board issues thing is it really? I mean, like if it has anything, which I'm probably not gonna walk into their office unless it has something to do with the hospital. So that's would almost classify as a board issue.
It is. But if it's personal, it doesn't matter. It's personal. You can
Right.
talk about
Well,
anything you want.
even if you walk into an office and you say, can you explain
Right,
IV
which I don't-
fluids, you know, whatever, I don't know. That's not the issue. The issue is saying, we're not gonna do that anymore.
Right.
Because I'm the board member and you're not gonna do it.
Right, and that to me is a terribly wrong thing to do,
Right.
what you just described. But I don't think it's wrong, and this might be where I am wrong, but I don't think it's wrong to go and say, so what's your opinion about this?
If it's a board issue, it needs to be asked in the board meeting. That's the way it's supposed to work. Because if you ask about board issues to an employee by yourself, then that employee's like, should I tell them this or not? And then all 6 other members don't have a clue what you're doing. And that's not how a board works. The whole concept of working as a one unit is a difficult concept to figure out sometimes because it's not about personal issues. It's not about, you know, common simple questions about something else. But if it's about finance, quality, ethics, any of those things that we manage or and manage is a bad word because that's what I said we don't do. But if we oversee those particular things, then that's stuff that needs to be discussed by the board in the board meeting. And they do say, you know, everything that I've ever read said that it's very difficult because our time in a board meeting once a month is very short.
And I just, so, you guys that are from here, from Wyoming, do you think that's works?
So I disagree completely with what you said, Dottie. I actually agree with Anne because I feel like it is my duty as a board member to gather as much information as I need to make a decision on a topic that the board is going to discuss as a whole. So I believe it's my duty to come to the board meeting prepared. And sometimes that means gathering information from other employees in a one-on-one setting instead of in a board meeting. So if I ask for information, it might not be ready for the board, or it might just be clarification that I need in my particular. Maybe you understand it totally, but I don't. And so I need to gather more information in order for me to decide if it's a good idea. It's my way of coming prepared. So for you to say that we're not allowed to go out and gather information on our own in order to make decisions together, I understand what Anne is saying. And I get her confusion.
So if I could add to. Can
I'm
you
sorry?
hear me?
Allison, go ahead.
Can you hear me?
Yes.
So
Yeah, it could be louder. Try it again.
Okay, is that better?
A little bit, not much.
Not much.
Okay, I have my headphones on. I'll take them off.
We got you.
There, is that better?
Yes.
Better.
Okay, so what I was gonna say is I've had this
You're breaking
And
up now,
Terry,
Allison.
that makes total sense, but the problem is the board is not the investigatory body. And so what needs to happen is if you have questions and you need further information, you should bring it to the board chair and or the CEO and request the information be presented to the board. Because the point is, in order for the board to make a decision together, they all need to hear the same information.
Right, and just one thing, Carrie, is that I'm not saying you can't. I'm repeating what every guideline I ever read about board guidelines says. That's how a board works the best, by following the guidelines so that everybody is included and everybody hears and everybody knows. Go ahead, Allison.
Yeah, and did you guys hear what I said?
Some of it.
Okay, yeah, so the issue is you need to have everybody hear the same information. And so if you want to have information presented to the board, that's the proper way to do it. So you all can hear the information, you can all ask the questions. And that's the other reason you have committees, is so that if it's something that's more appropriate for a committee, it can be handled there and then a recommendation can be made to the board. The problem with going directly to employees on things that pertain to the board is that first off, you're overstepping your board bounds in some ways because you're not the manager of those employees. So, you know, if you're going to have those conversations, the common courtesy would be to go through the CEO first and say, hey, I'd like to understand this better. And the best way to handle it would be to say it to the CEO and the board chair and let them decide, is this something we should bring to the entire board for a discussion or an educational piece? I understand that doesn't always happen, and some things are small enough it doesn't matter. But if it's something important enough that the board's going to decide on, it's much better policy to have the entire board hear it.
And I think as I sit and think about it, is that, you know, everybody works differently and processes things differently. But the issue is that the board as itself is not individuals, it's a group. I can't say that enough. So if one person is asking questions of this department and these people here, and first of all, it's inappropriate behavior for a board member to do that according to all guidelines that I've seen. And it also puts the employees in a bad situation. And then you get X information, but the rest of the board doesn't get it. So this way we keep it streamlined and the communication is clear and everybody hears the same thing. That's supposedly the way it's supposed to work.
And it keeps you from going into sometimes a liability issue, a lawsuit to where, so if a particular employee, say Kim, it could be Dottie, it could be Connie, or it could be one board member saying, Kim, I want the quality scores on these two patients and I wanted to know why they're so bad. I want to know when this happened and I want this emailed me by 2:00 p.m. and it's abruptly done. So that puts you, the board, not only individually, but as a whole in a harassment suit from that employee. So you want to avoid that, but as CEO, it's my duty to protect you as board members, to keep you out of those liability issues and keep you educated on what, you know, the board's role is and responsibilities are, and keep you out of those types of situations. Just because I've been through a lot of them. That and Purdy.
Can I ask a clarifying question? So that, or Jamie and Nick are also on quality. If they come ask me, is that not go to you?
Well,
like if they want clarification on quality issues, but they're on the committee?
We communicate though.
Yeah, three of us
We
communicate.
never like us, never Nick.
Sure.
So
Okay.
we would never, we've never.
Are you
done that.
saying in your office? Or are
Yeah,
you saying-
like if Jamie were to come in and say, hey, I read this event, can you pull me more information on that for quality committee?
Well, Jamie's the chair. And
how about Nick then, who's not chair?
That information should probably go to the whole committee then.
Okay.
So just say I'm meeting with, send an email out saying I'm meeting with Kim. And you're trying to include as many people as possible into the communication between whatever's happening. Right? I mean, that's really what we're trying to do. It just is everybody's involved in the, hey, I'm gonna go visit with this person. What do you guys feel about this? This is my concern, or don't say anything like that, or say, hey, can I visit? Say, hey, can I visit? Yeah, I can visit with you. This is what I'm just curious about this. And you know,
How do we go
on the
about this?
HVAC situation, can I go see how it all works? Can you?
I'd be more glad
Can we do a walkthrough so I can get a better,
and
bigger
I've done
picture?
that before.
Right, yeah, and that's where, because I need to see it sometimes, and
Right.
I understand what you guys are saying, but that's where I would be.
Right.
And then everybody knows that we're having that conversation, like
Right.
we went on a tour to see how everything works.
Yeah, and I think it's in the best interest of all the board members to take a tour once a year on the entire facility, look at board, look at bank, or take a trip to the mechanical room, see how all that machinery operates and what it costs to operate it and keep it. I really do. I think it's very important.
the other thing that happens is you don't know what the employees are involved in.
Right.
So, you know, they might be super busy, or you might be asking for things to have them do extra work. You're not their boss.
Right.
You know, we can't ask the employees to do those things.
Well, and here's what could come up. We could disagree on something that happened in quality, right? But we would tell each other, as being transparent, hey, something needs to be done. You might go, well, I don't think so. Okay, and then we can discuss that.
And if it's something that needs to come to the board, we bring it to the board.
I think the big thing here is we talk about the transparency is the buzzword of America right now. I think transparency has to happen within the board is what you're saying. At the same point where there's transparency with what everybody's doing, and accountability for all people, not just select people looking for people that aren't being
Right.
transparent, if that makes sense. But I feel like that's good. It's got to, yeah. If that makes sense, I hope that makes sense, but that's where I feel like
So
you're not being
I think
transparent.
that to bring that around to the document that we were discussing, the answer to that question was perfectly clear to me after the training that we had at 5 o'clock. And it's very blurred by the document that's being presented now. And I think that's the problem.
In what way?
How is it different?
Because the training at 5 o'clock was a overview of board responsibilities that I thought was nicely done and clarified it. Like, it's a great new board member training. And this one just gets too into the weeds. It adds stuff and breaks out the chair and the treasurer and then the secretary, and it blurred the lines and it made the board more unequal. The first training was very clear in that these are all the board members' responsibilities. This document says these are the responsibilities of some and these are the responsibilities of others. And if you're doing this for new board member orientation, the other one is much better. There was less ambiguity.
I think this one does spell it out a little bit more, and the other one didn't talk about chair, secretary, treasurer, and we have that.
Right.
We have that with this board. The other one was broad, good training, but it's broad. This one brought it down to our level.
And
So
you need that.
I think we need both.
You need both?
That's
Right, you
fine.
do.
I was gonna say both. would
I
be
make
good.
that motion that we include both, the training that we received and this document to go into the orientation. So that is a motion I'm putting forward.
Do I have a second?
I'll second.
Any further discussion? So the motion is for both
Both
documents to be
documents
used.
to go into the orientation.
Any further discussion? All in favor?
Aye.
Opposed?
No, I'm a no.
Okay, one no. So that's one, two. Okay, so we passed it. That document, both documents will be included in the board training. Okay. Thank you all. Now, one thing I want to add on to this, while we're talking about governance. Ann and I also had a discussion about the committee. There's a miscommunication about why the 3 board officers are on this governance committee. And it's because the 3 people that are on the committee today are the only 3 people that wanted to do it to begin with, okay? We were available, no one else had the time for various really good reasons. I mean,
Because we work.
right, so the board, the governance committee is not made up of the 3 officers because they want to be in control. It's because they're the only ones that wanted to do it.
And
So, go ahead.
excuse me, and we did talk about if we want to switch out monthly.
You're
Like
right,
say if Connie wanted to come 1 month or you did, Anne. You know.
I'll do my best.
So, you know, building on to what Jamie's saying is that we had a discussion about, well, what if there is somebody that wants to spend a month or 2 coming to the meeting, giving their 2 cents, you know, being a part of the conversation, working on, we're really working on board orientation, any policies that, you know, we'll probably end up start working on some financial policies when we get to that level. And so if that's something that people want to do with governance, because it is pretty intense. I mean, we spend 2 hours a month plus off duty you know, where we do all this work to bring it to you guys to review and talk about and then approve or not. So we can either do that, or we could come up with a list of things that need to be done and give out assignments. Like you guys, like you take blah, 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 you take blah, 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 and next meeting we'll bring it back and we'll talk about it. So, you know, that's something I would like you to think about and kick around, because I'm not married to this. You know, it's just, we were the only three people that were available at the time that had the time or the interest in doing it. So.
Yeah, and it doesn't say in the bylaws that it's which I felt like it did before, that it's the secretary, you know, that it's the.
Right.
Well, we talked about it.
Yeah.
You know what I'm
Well,
trying to say.
And I don't
Yeah.
think it's also that we can attend any committee meeting that we want to. It's just that we're assigned to make sure we're representing
Right.
at certain meetings.
But
is the way
once
I
you get
interpret.
over the number, then it becomes a quorum and you can't.
Well, here's the
Well,
deal
you
with that.
can, but you can't. Oh, sorry.
No, that's okay, Jim.
No, go ahead.
But the bottom line with that is if you read the bylaws, it says you have to give the chair 24-hour notice that you're coming, which is fine, you know, and then you don't speak. You sit and observe, and that's fine too. Or you can switch out, you know, in the from the governance committee. That was an issue in the discussion, so.
It might be a way on the governance committee to do it, project.
Yeah.
You know, because some people, it might make more sense to have.
Do stuff at home.
Well, no, well, yes, but I was thinking more like, if you're doing finance policies, you might want to have more representation
Absolutely.
from the finance committee, or if you're doing.
Bring in
You know,
experts.
Right, that might be a way to switch where you keep having your continuity. Rather than monthly, like I think as a committee working, switching different people in and out on a month by month basis would get.
Well, some people had said that maybe it would kill the continuity of what you're trying to do, but on the other hand, if you could get up to speed and just pick up where the last person was, I mean, it's up to you guys, but I think it's something you need to think about, and we can actually have a discussion on it next month, if that's okay. Is that okay? Okay. So that was in the governance. Oh, no, one more thing. Allison, on the beginning of this document, I put in here that we had to complete the Wyoming Department of Audit Certification, House Bill 60, and I believe that you guys were gonna do something that we could do by June.
Yeah, the Wyoming Hospital Association has asked us to put on that training, and so I don't know when they're scheduling it, but Tom and I are putting that on at some point before June.
Okay, great. Thank you so much.
You're welcome.
May elections.
On that note, which is you're right. There is if somebody wants to get involved, there is a training that they're doing with the guy who's in charge of.
Conservation District.
Thank you, Carrie. The conservation district, Caleb, is doing a training for board members on the 10th of January.
Okay, does this meet the qualifications for the state law then?
Okay. Conservation, what's it called?
Conservation District.
Did you get that, Denise? Okay, good.
Did you say January?
January 10th. You can let her know on January 9th. What's that?
Caleb Carter on the
Yeah.
team.
I know that was very long for you guys, and I'm really sorry, but we're done that part. Foundation board?
Oh, we had a very lively meeting. It was it was energetic and so forth. We looked at a lot of ideas, and we're planning to have several fundraisers, and one of them that we need to straighten out or whatever is going to be a daddy-daughter event. It'll be like a mini prom and
limousine to
I
pick
love
the
that.
girls up, and we decided, and kind of gonna expand on this, that there are people in the community and county, and I don't like to see any young girl left behind that we would pay for if they couldn't pay for to attend such a ball, a daddy-daughter ball, and we would pick them up in a limousine and if she didn't have a dress, we would get a dress for her. Actually, when I go home for Christmas, I'm probably gonna bring about 15 dresses back that are prom dresses and all of the other stuff that were $600 and $700 that have been sitting in the closet for 10
Nobody-
years. And they can't sell. So they're coming back with me to make sure a daughter has a dress to wear to this special event. I think it's gonna be great. But I don't care if the kid does not have any money. If I would see a girl out there crying because she could not attend this ball, I would cry myself. And we decided that we would make sure that these girls had the appropriate dress, was in the limousine, and would be at the ball, even if I would have to go dance with her. I don't care.
Pictures,
Everybody
tiaras.
think it's-
I think it's so cool.
So we're working on finding places to have it, to host it,
Age
and,
group,
pardon?
age group, just.
We didn't limit
Yeah,
it.
Okay.
We didn't limit it. If
Nice.
97-year-old lady wants to dance with her dad, we're
Yeah.
go for
there's no way.
it, you know?
Come and dance with me. Anything fun.
No, I needed
I'm way
that.
older.
Well, I can do it.
And we certainly have many things to hammer. We're planning a total of 4 events. The golf tournament will happen again. We looked at some community things. So that was very exciting, and that's probably the most news to come out of the foundation.
It was it was very productive, I thought. I really did.
Very energizing.
Yeah.
Connie,
I
are you
think
gonna,
it's amazing. Go ahead, Jim, sorry.
are you gonna reapply maybe next year for the, what's it called, Festival of? Or, I mean.
We thought about it, but it was kind of brought to the attention that we probably won't get it.
That's
Because, because some of the organizations they pick to support don't have any other funding sources. So, but that doesn't mean we can't and so forth. So that would be foundation. And I'll just move on to ethics and help me out with this. We're still working probably forever on mental health issues, and felt like some things were a little better, but it's always kind of ongoing. I don't know anything anybody else wants to talk or so.
Does, the people that are gonna come to the clinic once a month, is that helpful at all?
That was one thing we talked about. We're looking forward to that. We're looking forward to Volunteers of America having their building complete, and hopefully more presence, but
didn't the minister show up?
he did. He did.
And who was it?
Ben Roberts,
Okay.
Pastor Ben.
Oh, I had
Roberts.
that backwards.
It's
What's
easy
your
with the
first
being
names?
two
Yeah.
names. And I would kind of like to ask for your indulgence, which I might not sort of, but it would be like, because Connie and I had talked in ethics that we would just ask somebody, and we hadn't come to the whole group, which we should have, but we didn't. And so,
And I didn't ask him.
and so I would like it, you talked about going to the
I talked to the head of
the
the ministry.
ministerialist.
Ken Pitlick.
Yeah.
Yeah.
And so anyway, I think it would be nice if we could just
rotate through there.
Well, I think it'd be nice if Ben could stay with the ethics committee and you could rotate through people for praying for the.
That's perfect.
He used to be a nurse before he got in the military, or maybe at the beginning of his military. But,
does anybody have a problem with that? Because I don't.
I've never met him before.
Yeah, he's fairly new. He's just been here for 2 or 3 years.
Nice guy.
And I don't think, you don't have to worry about not asking. We talked to the the minister goal, so it's part of that, and it's gonna be good.
One thing that we did need to do, that we didn't, is we need a confidentiality agreement for him.
When's the next meeting?
March 13th, I think.
Yeah, March 13th or 14th.
Okay, so we have some time. Yeah. Okay, question, do we have foundation minutes or ethics committee minutes?
Joanne Akers takes the.
Joanne does?
Uh-huh.
Can we get those from Joanne, please, Denise? And then ethics, do you keep
I
minutes?
don't think either of us kept. I don't think we have, because sometimes we do with some patient.
It's very hard to take minutes and talk. Trust me, we know. Right, right.
Oh, no.
Well, the other thing that we did learn about in ethics and was about some of the policies in terms of the internet and use, patient use, and inappropriate use, and safeguards for our system versus some of the stuff they might be looking at. And Melissa had an assignment, I can't remember what that was. She was gonna check, bad behavior. Yeah, naughty.
Bad behavior of who?
Well, there's just some patients that are being.
Oh, we know.
So her task was to find what other facilities might be doing to make that have a little bit more teeth, I guess, a little bit more seriousness.
You just have some patients that are being mean to the nurses. And so it's just, how do you manage that?
Yeah, Melissa's trying really hard to do whatever she can. But, and then there's some people that there's just nothing you can do. But you talk about a lot in quality that, we see that this person, this aide got hit in the face, or this one got tripped, or this one got punched, and I feel bad for the staff, obviously. I mean, like, you know that there's potential for that, but it's, what can we do to help this person control themselves better? From a medical perspective, from a discussion, like, I can't just.
So it'll be.
Well, that was a good topic. Okay, well, can we try to take minutes in March? That would be good. Okay, moving right along. Items for the future. February 7th. What does it say for these?
Spot finally.
7 to 26, May special district candidate. Oh, filing. Now I get it.
For the
4.
May special district.
Correct.
So I have the dates for all of them. I think I sent them to you. And if we don't have them, let me know. So, next month, we need to, make our proclamation that we put in both newspapers. Does anyone have a preference whether we do it for 1 week or 2, because it's our choice?
I'd say we do it for 2.
That's
I
what
agree.
we've done in the past. The museum district only does it for 1 week, but we've always done it for 2.
That gives people a better chance to see it. Yeah.
But I understand the importance of the question, because it does cost money.
It does cost money. It
To
is.
do that.
So that's why I wanted to ask you guys. Because it is a cost. And then in February, from the 7th to the 26th is when the candidate filing is, and that is here at the hospital to me. So
Just from February 7th to the 26th? Why is that? Is that law?
that's law. These are all mandated by the state, so I have to follow them.
And it
No,
has to be printed up on a ballot.
no, I know, but I would think they'd give it till at least March, April.
And then in April is the publication of the director candidates. And then May 7th is the elections. I do have a question on the special district elections, and maybe this is not something we have to answer tonight, especially since Leanne is not here to weigh in on it. we usually, in the past, we have done, and it's up to us where we have the election polls. We've done it in Newcastle, usually at the library. Last time we did it in Osage at the fire hall, and then we do it at the community center in Upton, and we like to do it in all of the different communities, so it's available for everyone. However, each district needs to get 3 different people that that sit at the polls. So we do pay them, not very much do we pay them, but we do pay them an hourly wage, and we feed them, and that's why a lot of them like to do it, because we feed them well from our kitchen. And but we don't even, I don't think last election, we even had 30 or 40 people in Osage. So I just want a little guidance on what your thinking is. Do we continue to do it in Osage, or do they have the choice to go to Upton or Newcastle? So it's not something that we have to decide even in the next month or 2, but I wanted some guidance because it does cost us a little money to have them, and I would like to have it available. But since Liam does live in Osage, okay. So just something to think about, and maybe, I don't know, talking to other people, but we did it at the fire hall last time, and I can tell you, I have the numbers. We usually get maybe 100 people in Upton. We usually get under 50 people in Osage, and then we get around 300.
What about mail-in ballots?
So I used to be that I could tell you every year we would get under 30 mail-in ballots, and actually the most of that was from the manor. However, after COVID, when we had 300 mail-in ballots that year, last time we had about 80. So we had more last time than what we averaged. So it is getting more popular, I guess. But those are taken to the polls and counted in the numbers.
Interesting.
Okay, just something to think about. If you have any questions, please don't hesitate to ask. Oh, one more thing, just in case everybody doesn't know, we do have 4 seats open. This is the year that we have 4 seats. We vary from 3 to 4. So 4 4-year positions.
Like a lifetime.
Well, I think they need to know what a board member consists of and all the hard work, and with some of this PowerPoint presentation and all that, because it's a hard job. I don't care who sits on the board. It is an extremely hard, stressful job.
I do also make sure that all of the candidates know when the meetings are, so that if they would like to come to the board meetings,
Oh, that's a
they
good
are able
idea.
to do so.
Great idea.
Yeah, that is a good idea.
Okay, guys, we're gonna break to go into executive session, and we'll meet back here at 4:00.
Who's moving motion?
Nobody made a motion.
I move we go. into-
Okay, and
Thank you, Ann.
second,
I'll second it.
All in favor?
aye.
Opposed?
Yes,
That's our ice cream.
please.
Come on.